is supposed to have a normal odor. It shouldn't smell like roses, or like these myths about drinking pineapple juice changing the scent or the taste of vaginal discharge. But for the most part, this is just misinformation. And it kind of perpetuates this feeling that if your vagina doesn't have like that scent of like roses or like soap or whatever, that we're unclean.
Welcome back to yet another episode of Sex Talks Podcast with me, your host, Selma Ndasilohenda Iyambo. As always, I'm super excited to be here with you, and I'm beyond grateful that you chose Sex Talks Podcast once again. If you're a first-time listener, welcome to the Sex Talks Podcast family. Here, we are all about creating an informed and educated society of young people who can openly have conversations on sexual health matters while sharing their personal experiences and hearing from experts in the field. We are recording yet another episode live from the Be Free Youth Campus thanks to our collaboration with the Be Free Studios under the One Economy Foundation. You can find this youth-friendly space at the Windhoek Multipurpose Youth Center or online at Be Free Namibia. And if ever you find yourself in the area, please do come say hi. We'd love to hear from you and see you. Now, in today's episode, we dive into a topic that many of us experience, but we rarely speak about it. Vaginal discharge. What's normal? What's not normal? And when should one really be worried about the type of discharge that come out of their vagina? Joining me is someone whose research has changed how we understand this completely. This is Dr. Cara Dunaiski. She is a senior research scientist at the Namibia Institute of Pathology. And just before we can be able to dive into this discussion, we'd just like to give a trigger warning as this episode contains discussions about sexually transmitted infections and reproductive health. If you're feeling overwhelmed, please feel free to pause and come back when you're in a safe space. Dr. Dunaiski, how are you doing? And please welcome to Sex Talks Podcast.
Thank you very much. I'm very honored for the invitation and for the opportunity to talk about something that's very, very important.
Well, I appreciate the fact that a scientist took time from her very busy schedule to sit with me. Like, wow, guys, what more can I ask for? Now, Dr. Dunaiski, let's start with the basics. What's vaginal discharge? And when can someone tell the difference between what's a normal discharge and when I should be worried?
Right. No, that's a very excellent question. So, vaginal discharge is actual part of our normal physiology as women. Normally, it has a clear or a milky color. We have different states in our normal physiology. For example, when we are ovulating or around the time we're menstruating, where the discharge may change, but all of this is normal. The vaginal discharge is very, very important because it also has an important function in cleaning the vagina and making sure that the environment of the vagina is healthy. And it's normally when there's a disruption in that environment that we may encounter some problems, and this is now the abnormal vaginal discharge. There are many ways in which to identify when vaginal discharge is not normal anymore, and this could be changes in the consistency of the discharge, changes in the color of the discharge, or even the odor of the vaginal discharge. So normally when it's thick, white, mucoid, has a green, yellow, or gray color, and when there is an unpleasant odor, it kind of indicates to us that there might be a problem with the balance of the environment within the vagina. But the important thing is also to understand that vaginal discharge syndrome is what we call it when it's abnormal. It's not necessarily caused by an infection. It can also just be part of the shift in the balance within the environment within our vaginas. Yeah.
Looking at you, but like now based on this description that you have provided, like sometimes it has color, other times it has some sort of smell. Are there like times of the month when you know that the smell is more likely to change or the color of the discharge is more likely to change, so that at least we know this time of the month it's kind of normal and this time it's not?
Yeah. So again, but this also depends on from person to person. But generally, when the vaginal discharge is kind of normal, it will, like I said, it will have a milky color, or it will be clear. And then specifically when we're ovulating, actually, the vaginal discharge becomes this egg white consistency, like kind of sticky. So this is also just an indication of like normal female physiology around our ovulating time. And generally, the odor of the vaginal discharge should not, be significant, or it shouldn't alert us that maybe there's a bad smell, or for the most part, the odor of the vagina is just normal. It's when there is an unpleasant odor that it can indicate that there's a problem. Yeah.
I was listening to you speak, and I'm like, wait, when I'm ovulating, what color is my discharge? Do I keep track of this? And this question goes to our listeners as well, as to how often do you keep track of your discharge, the smell of your vagina, and everything else. Now, doctor, I also have another question in terms of, we have this perspective of the vagina is supposed to smell like roses. That's like, you I don't know where it comes from, but we have this in society of, this is how a vagina is supposed to smell like. What's your take on that for somebody that has done studies on vaginas, to be specific?
Well, it's just utter miscommunication, like misinformation. And, I kind of feel like it's a marketing scheme as well for all of these companies that are selling us vaginal washes and things like that. A vagina is supposed to have a normal odor. It shouldn't smell like roses, or like these myths about drinking pineapple juice changing the scent or the taste of vaginal discharge. But for the most part, this is just misinformation. And it kind of perpetuates this feeling that if your vagina doesn't have like that scent of like roses or like soap or whatever, that we're unclean. That's absolute nonsense. If I can just be very direct about that, it's absolute nonsense. Again, those are marketing schemes, and again, it gives us a false sense of feminine hygiene. This is those soaps and things, they actually causes a disrupt the balance within the vagina, and can actually cause infections, as opposed to making it smell
like roses.
Yeah.
Now, going back to your research, you have found that many women have yeast infections. What exactly is a yeast infection, and why are so many people getting it? Where are we going wrong?
Right. Again, a very excellent question. So yeast infections are actually caused by a fungus called Candida. And Candida is actually quite prevalent in many areas of our body. You find it in the mouth, you find it in the gastrointestinal tract, and you also find it within the vagina. And it's actually we call it a normal commensal. It's a happy organism that's just living there. And what happens is that when, like I mentioned, when we have a disruption of the balance of the normal environment within the vagina, that is when this organism, this fungus, can overgrow and actually lead to some of these symptoms, including itching, burning, even pain when having sex, and the discharge, and also sometimes unpleasant smell. And so you're asking where we're going wrong. Again, I just like to emphasize that yeast infections are not necessarily a sexually transmitted infection. And this is because, like I said, the organism already exists within the vagina. So again, it's coming to what are the human behaviors that leads to this organism in overgrowing. So this is, again, just normal behavior, like wearing tight clothing. Are you on hormonal contraception? Have you taken antibiotics that can also shift the environment, the microorganism environment within our bodies? Are you menstruating? different things. Are you using soap when you're washing your genitals? Things like that. Do you douche? So those are the things that can actually influence the balance of the environment within the vagina. And once we take a look at those behaviors, then we can, shift towards having, a little bit more a healthy, holistic approach to, cleaning our vaginas. And again, it's not a matter of hygiene. It's just a matter of education, awareness. What do we actually know about our own bodies and how to deal with our own bodies? And once we have that shift, we can really affect the decrease or the reduction of these infections.
Amazing, doctor. Now, as you speak, there's something that comes up in conversations with young people when you have a conversation around, to have an STI or is it a yeast infection?
Yeah.
And many of us often lean towards having a yeast infection compared to having an STI itself. Can you please tell us what would be the difference between those two, so that at least we have it out there that you actually go for sexual transmitted infections treatment compared to you just saying, I think I just have a yeast infection.
It's actually funny that you say that. Before I worked for NIP, I was actually a lecturer at NAST. I really do have a passion about speaking about these things to young people. And in one conversation in the lab that I had, I actually asked some of my first year students, do you guys know what a yeast infection is? And they're like, ma'am, it's an STI. And I'm like, no, it's not an STI. And again, that comes down to, education and awareness about our bodies and different, infections. When it comes to looking at the difference between whether you have a yeast infection or whether you have a sexually transmitted infection, it's very, very difficult to actually tell the difference unless you have experience. You're like a doctor, or you understand, human physiology. So that's why when we are looking at STIs as well as disorders causing this disruption, there's an umbrella term, vaginal discharge syndrome. So, and this is because all of these potential infections or disorders, they can lead to discharge. So if you're not very confident, you really can't make that distinction between, is it a yeast infection or is it an STI, right? So because again, like I said, they have symptoms that are very common across all of these infections. And so the best thing is to go to your health service provider to go and check it out. I don't think I think it's best to go get the professionals to diagnose, to check it out. Yeah.
Well, sometimes I feel like maybe I come close to being a doctor, but we all know that experience of now having an STI when you see a discharge. And I don't know why we lean more to a yeast infection. Maybe it's because of the stigma associated to it and the fact that it's not sexually transmitted, so it kind of gives away that.
Yeah.
Okay, I haven't been having sex. I just got this infection.
Yeah, no, but that's the whole point. Actually, it's a personal thing. So obviously, if you are not having sex, then you can come to that conclusion that it's most probably a yeast infection.
Things so most of us, we are having sex. It's just a situation of, I don't want to tell the people I'm having sex.
But that's why we have the Be Free Clinic, where young people have a safe place to come and talk about these things and actually disclose their clinical information in a safe way.
Oh, you guys had it from her. Be Free Cares Clinic is right here for you. Should you feel that you have any of the symptoms or you need a doctor to check this out for you, we are here for you. Now, doctor, and just before I say this, guys, I feel like maybe I'm becoming a scientist just because I'm sitting next to one. But you've mentioned two types of yeast. Now, the Candida albicans and the non-albicans. Guys, I pronounce it right, so I might be a scientist too. Now, you've mentioned this too, and this sounds very complicated. What's the difference and why should we care?
Okay, so when we think about the normal culprit for vaginal yeast infections, we think of the most common one, which is Candida albicans. Candida albicans is relatively easy to treat, if it hasn't become resistant to the antifungals or to the medication that is available. But a lot of the non-albican species, those ones are actually resistant to the medication or to the meds that are most commonly available to treat vaginal yeast infections. And that's why it's something that is very important to take note of. So like a practical way in which, a patient can look at it is like when you go into the clinic and you're giving the normal meds to treat your yeast infection, and it seems not to be going away, then you can go back to the clinic and say, listen, this infection is not going away. Can we please take a test so that we can see which one it is, so that I can be treated appropriately? Because a lot of the non-albican species or strains, types of Candida, they really don't respond as well to the meds that are readily available. And, as a young person, I also think it's important that I advocate to you guys that, it's your body. You can request for a more definitive diagnosis. You can say, listen, please, can you take a swab and send it to the lab so that I can get the appropriate treatment?
I like how she just imparted us and actually made that statement of it's your body. So you must take ownership of it and make the necessary request for you to make a more informed decision and be more informed about what is actually happening in your body. Now, Doctor, going back to your research once again, it indicates that younger women and pregnant women are more likely to get the common types of yeast infections. Is it something that we are doing wrong? Is it our bodies, or is it just an age thing?
No, we're not doing anything wrong. As women, we go through many phases in our lives because of hormones. Because of hormones. And during puberty and during pregnancy, a type of hormone is quite high. Estrogen is high. And when our estrogen is high, this creates a really good environment for yeast, for the organism to grow. And that's basically that's just it. It's just part of our normal physiology. It's our hormones that are affecting the growth of this organism. And again, it's once you understand how your body works, once you really take agency of your body and you understand all of the cycles, how your hormones work, how they affect you, you're really able to feel more confident and not relate any type of symptom of your genitals to being unclean or anything like that. It's just how your body works.
I think there's one thing that I want us to take from this conversation is getting to understand how your body works. Also taking note of what changes in your cycles, what happens in your discharge. So at least you're able to pick up as to when is it not going right, when is something wrong, when should I seek the medical attention? Because now if you go to the clinic and they ask you all the questions of when did it start, how long has it been going, and you will be able to answer all those questions once you take charge of your body and try to understand and note all those things. Now, I think I'm going back to how you advocate for education in one understanding their body. Now, there's some girls that clean their vaginas with soap, or they even use products because they want to make it seem fresh, and that whole miscommunication or misinformation that is already existing. How is this actually harmful, and how can we as girls take better care of our vaginas when it comes to washing down them?
Yeah. Oh, wonderful. I love this question. So let me just go back to what does it look like normally? What is the environment within the vagina normally? So normally your vagina, first and foremost, has an acidic environment. So like lemons, and this acidic environment is very important because it helps in keeping the vagina clean. So eliminating organisms that might cause an infection. So that's first and foremost. And then when you use soaps generally are basic or alkali. So this disrupts that acidic environment within the vagina. And then this can allow for pathogens, meaning bacteria or organisms that are harmful to actually grow and cause an infection. So the long and short of it is basically that when you're introducing soaps or douches, or anything really into the vagina that can change the normal environment, it can lead to harmful bacteria or organisms to grow and cause an infection. So it's best to stay clear of it. How you take care or how you wash your vagina or your vulva is just by lukewarm water. That's it. That's just it. Nothing else, nothing fancy. The vagina is such a beautiful organ. It cleans itself. Yeah, it cleans itself. So you don't have to, no frills, no fuss, no rose-scented soaps. No rose-scented soaps. You don't really need anything except lukewarm water.
If I take a cold shower, then what happens?
A cold shower, no, that's also not too bad. A cold shower is also okay. What you don't want is to bathe or wash your vagina with water that's very scalding hot. And the reason for this is essentially it's a sensitive area, and so you don't want to basically damage the skin or the type of tissue in the vagina. When you damage the tissue within the vagina or the cells in the vagina, what happens is that you can also, it can cause inflammation, and once that is disrupted, it also allows for harmful organisms to, be able to invade and cause an infection.
Wow. This is why I absolutely love being the host of this podcast, because I get to learn a lot from these conversations, and I hope all of us are taking something from this conversation. And I was looking at her when she says just lukewarm water. How many of us actually clean our vaginas with lukewarm water only? No scented soaps or anything to make it smell like roses. Please do feel free to comment, engage with us, and see how have you been doing this? What are you learning from this conversation, or what will you do differently from here? Now, I love how I keep referencing your research, and I absolutely love to share it with our listeners as well, so you would be able to get it from our various social media platforms, just so you can be able to read more about the conversations that we're having. Now, based on your research, you found that STIs, bacterial infections, and yeast can all cause discharge. And you also now mentioned as to none of us can be able to tell what the difference is unless you now go to a healthcare provider. Now, going to a healthcare provider comes with a lot of stigma. It comes with a lot of, not even just from society, but from oneself, as to what have I been doing wrong? What advice would you have to somebody that is currently going through something, but they have questions within them about, must I go? Must I not go? Or what would you say to that person?
Well, that is a complicated question. We do live in a society where we stigmatize basic rights to healthcare. And again, it goes back to knowing your body, understanding your body, and then, knowing then when you have to now reach out. Again, we have a wonderful clinic, Be Free Clinic, that is free for healthcare, for group discussions, a safe place in which young people can come to with regards to their health, to their mental health, and to talk about things that are stigmatized in society, like sex, like homosexuality, sexual orientation, and and these types of topics that are considered to be
taboo.
Taboo in our society. But when we come back now to the vaginal discharge, and not having maybe the money or being able to access healthcare, even if it's free, when you have the the yeast infection. Yeast infections are actually quite easy to, I wouldn't say easy, but it's a lot more simpler to identify because the discharge is very, it's a prominent, thick, white discharge. It kind of resembles omaire. That's what it kind of looks like. So it's yeast infections are easier to distinguish as opposed to bacterial vaginosis and STIs. Now, when it comes to bacterial vaginosis, this is also not a sexually transmitted infection, but it is also caused by disruption in the normal environment within the vagina. And it can actually lead to kind of a grayish colored and foul smelling discharge. So that foul smell really kind of helps, to determine that it's bacterial vaginosis. But again, discharge is really, or the symptoms associated with vaginal discharge syndrome, with abnormal discharge, are quite common across the board, and so it's not that easy to distinguish. And then when it comes to STIs, again, it's an array of different symptoms that you can find. You can have a green, yellowish colored discharge. You may have an odor. You may not have an odor. And then the other thing is also to be very honest and to be direct. There are many instances where we actually have cases where no symptoms appear, where no symptoms may appear, but the organisms are present. And so, and especially when it comes to STIs, that is when you can actually spread, the organism, although you don't have symptoms. So the best way really for you to address this, not being able to go to a healthcare, is by education and by behavior. What do we do in our normal everyday lives to make sure that we have, that we maintain our, vaginal health? Do you wear tight clothing? So that is a question that you have to ask yourself. Tight clothing, breathable underwear. Do you use soaps or douches to cleanse your vagina? After sex, do you urinate? It's important to urinate after sex to rinse away any remaining semen or things like that can also lead to maybe an aggravation of the vaginal environment, things like that. Do you wear a lot of layers of clothes around your vagina? Things like that. Just normal behavioral things that can really determine, or that you can change in your everyday life to maintain, vaginal health.
Oh, thank you so much. We'll get there actually. We have the quickfire segment, so I'll get you there.
Okay.
Now, before we move to the quickfire segment, which is my favorite part of the podcast, is social media is full of advice about vaginal health.
Mm-hmm.
What are some of the myths or bad advice that you've come across that young people are sharing online, if you can share some?
I think the one about drinking pineapple juice or pineapple juice to make the smell of the vagina better. I think that one is one of the myths that I just
Is it only pineapple juice or even the pineapples that we eat? Do they help? Just be honest.
No, it doesn't help.
What?
No, it doesn't help. What does it help with? Pineapples taste delicious, and you should consume it for the multitude of vitamins available within pineapples and pineapple juice. But really, if you think about it, how does something you consume that is digested by your body altering the scent of your vaginal fluid?
I don't know how I feel about hearing this and knowing this now. I genuinely believe, I believed it helped.
But I think again it comes down to this, this idea of a vagina should smell a certain way, especially when it comes to, I don't know, am I allowed to talk about sex?
Yes.
Oh, I understand, but When it comes to receptive oral sex, we don't talk about that enough as well, because there's this kind of idea that the vagina should taste sweet or should smell a certain way during receptive oral sex, and that kind of creates that misguided intentions around consuming certain certain drinks or food to alter the smell of the vagina, and we have to rethink about the way that we talk about sex, and the way that we just generally think about it, about smells, about discharge, about sexual orientation, about the stigma around sex. And I think once we are able to, as young, I consider myself still a young person. I'm less than 40. When the way that we talk about it, I think we can be more educated. Indeed. Just in general.
Indeed, that is true.
Yeah.
Now, we're moving into the quick segment, and I love how you've mentioned about one needs to urinate after sex, and how we have the notion of how vagina is supposed to smell, especially during oral sex. Now, for the quick fire segment, your first question is, what are the 3 tips that you can be able to give us as girls in terms of 3 aftercare tips, aftercare tips, after sex care, actually, tips that you can share with us apart from now urinating?
After sex, first and foremost, we should have protected sex. That's the first thing. And then, sure, after sex, that one is tough because it's protection and during sex, and then after sex, try to urinate if possible. And then again, I think I will come back to like the just general vaginal health care. Not washing with soaps, and then also really trying to wear breathable underwear. Yeasts, specifically yeast, and some of the organisms that causes bacterial vaginosis, they love darkness, they love warmth, so that's how they grow. And so if you're able to wearing breathable underwear, that really does help a lot.
Amazing. Yeah. I don't say I don't love how I put you on the spot, but I actually love how you come back every time I put you on the spot. So amazing. Now, another question, or your second question rather, would be, what's that one myth about vaginal discharge that you wish every young person would stop believing in?
That you are dirty if you have vaginal discharge. Vaginal discharge is normal. There's normal vaginal discharge and there's abnormal vaginal discharge. And even when you're having abnormal discharge, that doesn't have anything to do with your hygiene. It has to do with different types of hygiene habits. It has to do with, just in general, it has to do with how you wash yourself, about how you just generally how educated you are about vaginal health. It has nothing to do with how cleanly you are. So that is a myth that I really want to be
erased.
Yeah.
Now we're moving on to the last question from the quickfire segment. And your last question from the podcast is, if you could give one piece of advice to a teenage girl about her vaginal health, what would it be?
Know your body. Educate yourself about your body and how it works, and exercise your right to healthcare.
And that's it for us for today's episode. That is the 5th episode of Sex Talks Podcast. Thank you so much, Dr. Cara, for taking time to be here with us, for breaking down the facts about discharge and vaginal health. Personally, I feel very empowered and have taken a lot of notes from this conversation. To our listeners, your body isn't dirty, and your questions aren't shameful. Discharge is normal, and knowledge is power. And if ever you need support or you need to be checked out in terms of your sexual health, please do feel free to come to the Be Free Case Clinic. We are located at the Multipurpose Youth Center, or you can be able to send us a DM on our various social media platforms, and that is at Be Free Namibia, or you come through Sex Talks Podcast, and we'll gladly be able to make a referral, make a booking for you, or give you the necessary contact details for you to get in touch with somebody that may be able to assist you. And with that being said, until next time, please protect your peace, speak your truth, stay curious, and make sure to seek the necessary health services that you may need, like how Dr. Cara empowered us to do today. Until next time, amigos, adios. Yes, episode 5, season 3, and I'm still not getting it right. One day, guys.